Hello, my name is Dr. David Harley, and I'm a board-certified facial plastic surgeon specializing in facial rejuvenation, including extended, deep plane, face and neck lift. Over the years, I have performed many thousands of facelifts and neck lifts in the office setting under local anesthesia. Our patients have traveled in from all 50 states and from many countries around the world. I am currently offering my patients an extended, deep plane lift. This is an advanced technique that releases attachments throughout the cheek and neck to provide the most comprehensive and natural and long-lasting results that are possible in my hands. I do also perform ancillary procedures to go along with deep plane lifts, such as upper and lower blepharoplasty, lateral brow lift, lip lift, volume replacement, and resurfacing procedures. But for this video, I will be speaking mainly to the foundational, fundamental procedure that everything in my practice revolves around. And the reason that people are traveling great distances to our office here, and that is the natural vertical lift that is described as an extended, deep plane face and neck lift that we perform under local anesthesia. I grew up in Western North Carolina, and after high school, I attended Dartmouth in New Hampshire, where I graduated with a degree in English. I then went on to attend medical school at Vanderbilt in Nashville, and after graduating, I continued on at Vanderbilt to train in head and neck surgery. Following that, my plastic surgery training was completed in Houston, Texas. Since the time I completed my training, I have performed pretty much every procedure under local anesthesia with no IV, no breathing tube, and no general anesthesia. And I do it because I feel that local anesthesia with oral sedation is the safest and the most natural method of achieving a relaxed, calm, and perfectly comfortable patient experience during elective surgery. The first thing you will do to get the ball rolling is you will need to fill out the requested information form and send in some photographs of your face and neck. At that point, you'll be contacted by our patient coordinator, who will go over some basic principles about our practice and how we do things, and she will also gather some information from you regarding your goals and desires and potential treatments, and she will answer your basic questions. After this, you will be scheduled for a consult with me, which can be over the phone, or virtually, or in person. Together, you and I will review the concerns and the findings, and we will formulate a unique plan specifically for you. I will answer your questions, even the most detailed and difficult ones. From there, we will provide you with scheduling options that are available on our calendar that are suitable for your needs. You'll be given preoperative instructions to follow, including a list of medications and herbal supplements to avoid. We will send prescriptions into your pharmacy for these medications, and you will need to bring them with you when you come in for your procedure. You will probably want to spend the night before your procedure somewhat close to the office, because it is likely you will need to arrive early on the morning of your surgery. On the day of surgery, I'm going to sit down with you again, and we will review your goals and the planned procedure, and I will answer any final questions you may have. I will administer an oral medication by mouth that will give you a relaxing effect and a nice nap during the procedure. And then I will numb the areas where we'll be working so that you won't feel anything at all. Surgical incisions are made along and around the temporal tuft of hair, along the natural curves of the front of the ear, and into the sulcus behind the ear and into the hairline. A small incision is made under the chin, and through this incision, a platysmoplasty neck tightening is performed, along with removal of neck fat and of some muscle tissue. Through the ear incisions, an extended, deep plane face and neck lift is performed, releasing the attachments and the tethering ligaments and anchoring the tissues vertically. Once the stronger tissues have been anchored and a solid foundation has been built, the more superficial tissues, including the skin, are redraped, and the excess skin is removed. After the procedure is complete, I will go over instructions with your caregiver, who is preferably a friend or family member. This caregiver will stay with you overnight, and the next morning will return with you to the office for a follow-up visit. A written set of instructions will be provided, which will include follow-up appointment dates and times, as well as my personal cell phone number. Most patients spend the night close by, at a local hotel, bed and breakfast, or a personal residence. I do place an elastic dressing at the end of the procedure, and I apply it for compression on the cheeks and neck until the first morning after surgery. Due to the tightness of the bandage, certain patients will experience discomfort and even need to take some pain medication. This pain is generally mild and is typically described as a 3 or 4 on a scale of 1 to 10. But on the following day, once the dressing is removed, most patients are able to wean themselves off of the pain medication entirely. You may wash your face and even apply makeup 24 to 48 hours after surgery, but be careful to avoid applying makeup to the incision lines. I would recommend avoiding moderate exercise for the first 2 weeks after the procedure, but I do encourage you going for a leisurely walk, maybe around the neighborhood, beginning immediately after surgery. At 3 or 4 weeks after surgery, you may begin strenuous exercise. It is critically important to try and keep your chin tilted slightly up, or at the very least in a neutral position after the procedure for the first 7 to 10 days. This means that if you need to look at your cell phone or at a book, you should hold it up at eye level so that you do not have to turn your chin down. One way that people do this is by applying a neck pillow or a travel pillow, one of those round cushions that looks like a donut, with the fluffy part in the front under the chin. I also recommend that when lying or sitting down, you should not have your head elevated so much that your chin falls forward if you do drift off and fall asleep. In fact, I would rather have you fall asleep flat on your back with a pillow underneath the back of your neck so that the chin tilts up while you are asleep. This keeps the neck skin lying flat and not creased as it would if your chin turns down more. Most of my patients are presentable to the public within 7 to 10 days after surgery, which means most of our patients feel comfortable returning to the grocery store or to the restaurant or even back to work within the first week or week and a half after surgery. After the 1-week follow-up visit, we schedule a 6 to 8 week follow-up. Many of our patients are from out of town and return home at this time. I do request that all of my patients keep in touch with me through phone calls and texting. I love to see photos of my patients as they proceed through the recovery phase after surgery. I like to see photos once or twice a week for the first 6 to 8 weeks. It is absolutely wonderful. This way, I will be able to keep in touch with you and of course, even help you if you have any questions or concerns. I will be here for you. And if there is ever a desire or a need to come back for a visit, we will welcome you with open arms. Even if it means you would be traveling across the country, we will be here for you to see you. So I hope this overview and summary is helpful to those who are considering facial rejuvenation and facial plastic surgery, especially if you are interested in an extended, deep plane lift that is done under local anesthesia. Thank you for your time, and I appreciate the opportunity. It's a true honor and a privilege to do this work, and I thank you for considering trusting me with your face.